there's a stunning new report out. And what it says is quite hilarious. So it says, a stunning new report finds U.S. dead last in healthcare among high-income countries, even as one of the richest countries, despite spending the most on healthcare. So, there's a quote here, and it says, now this report was done by the Commonwealth Foundation, or I think it is, but it's Commonwealth, and they've done this 2004, 2005. They've done 7 studies, and every single time the U.S. has ranked last. Oh, America's so great, but we rank last in helping people survive. So here we go. If healthcare were an Olympic sport, the U.S. may not qualify for any competition with other high-income nations. How devastating of a quote that is. That if healthcare were like an Olympic sport, wow. I am terrible. We just heard the Olympics, and music, and saw it, and that was amazing. But if healthcare was an actual sport, the fact the U.S. would not even qualify. They wouldn't come a little close. They're a little far from qualifying, but they can get there. No, not even close is devastating. Now, we spend about 17% of our total our total GDP on healthcare. 17%. Healthcare is 1/6 of our economy. We spend $47 trillion. Just imagine that number if you can on healthcare, and yet we still don't have it in this country. Incredible. The report analyzed 17 healthcare provisions under 5 categories. There were 11 countries ranked. It was done by the, like I said, Commonwealth Fund from the Organization for Economic Development of the WHO, who was in cahoots with China, by the way, on the coronavirus. Now, the categories are access to care, the care process, administrative efficiency, equality, and healthcare outcomes. So, the nations analyzed: Australia, Canada, France, Germany, the Netherlands, New Zealand, Norway, Sweden, Switzerland, the United Kingdom, and the United States. Okay, and the U.S. Now, Norway, Netherlands, and Australia were the top performing countries overall, with the U.S. performing dead last. I'm just reading you these stats. Okay? All these nations are less rich than the United States. A lot of them are smaller. A lot of them are in Europe. And they have, all of these nations have one form or another of universal health care, either single payer or whatever, and they vary in different ways. And it's amazing how they rank number 1, and apparently Joe Biden says our healthcare system works, but according to this study that's been done 7 times, the U.S. has never ranked anywhere above last place. Wow. Now, the U.S. ranked dead last in access to care. There's really no surprise there because, people can't access it. They can't afford it. Administrative efficiency. Yeah, I wonder where the money's fucking going. It's going to bailouts. It's going to Wall Street. It's going to the freaking military. Oh, no, you know where else it's going? Price gouging. And I'm going to explain that. Equity and healthcare outcomes. Despite spending a full 17% of GDP on healthcare. Where's the money going, like I said? It's going to price gouging among the military and all that shit. It's going to the mafia middlemen of this country and the healthcare industries. And those that do provide actual healthcare charge astronomical prices. So even when people can get it, they can't afford it. The money is going to the for-profit healthcare people, the industry. We have a private healthcare industry in this country. That's incredible. And then it's going to big pharma. Now, the only areas where we did well, rates of mammography screenings and flu vaccinations for elder Americans, as well as the percentage of adults who talk to their doctor about nutrition, smoking, and alcohol abuse. Oh man, that's great, but we're getting trounced, obliterated in every other provision and in every other category. Every other category, provision, subcategory, whatever you want to call it, U.S. is last. And you really start to wonder why. 50% of low-income Americans say cost prevented them from receiving care. So you got the poorest of the poor who have Medicaid, right? And then we have those who are, low to middle income people who don't get Medicaid, but also don't get subsidized enough from Obamacare. That's incredible. 25% of high-income Americans said the same thing. Now, that's something else. That even people who earn $500,000 a year, now, they buy nice houses, they buy luxury cars, they buy shit they don't need. But either way, they can't afford it. We also have the highest infant mortality rate and the lowest life expectancy. The U.S. has ranked dead last in all 7 studies Commonwealth has done. So, the most in infant mortality rates, the least in life expectancy, the least in all 5 categories, all 11 provisions, or 71 provisions, or whatever it was. All of that, we were last. This is what's wrong with our system. We got a mafia middleman that's collecting it's a private tax that you're paying, and that's all going to them, and we're paying for the research, the development of drugs, and then we got to pay for the drugs. We got people that go into medical debt. 68,000 effing people that die because they don't have health care. Over 100 million people don't have health care, A, because of the pandemic, but B, because it's tied to their employment. Over 80 million people are uninsured or underinsured. What is it, 500,000 people go bankrupt? Like, you get a terrible illness, your doctor's like, oh, we can't cure you. But in Germany, but in Canada, people say, oh, but you got to wait long waiting times. Oh, that's so bad. Oh, my God. Don't we have to wait long waiting times here? The only difference is you don't get a hospital bill in Canada. And then people say, oh, my God, but then your government's going to run your healthcare. Aren't you afraid of that? Your grandma, when she goes to the doctor and she's on Medicare, she goes to a regular effing doctor. She doesn't go to the government, to some government office, and some jag-off dude is looking like, oh, man, what's your problem? It's a certified doctor, licensed doctor. He went to medical school, and guess who cuts him a check? The effing government. Literally, old people experience Medicare for all. We live in a rapacious oligarchy, and we got to get the F out of it, because this is stupid. We're ranking dead last in a category where we should rank first. I'm sick and tired of this system. And by the way, they took people to Great Britain. Politics Joe did a video. I don't know if I still have it. But he went and he asked people, how much do you think this costs in the? How much do you think an ambulance costs? A baby costs? An inhaler costs? And they were like $100, $200. He's like, higher. They're like, what? To have all of that? And then the UK government said, hey, we should go to the US healthcare. And people are like, no. Hell no. We have the worst healthcare out of any nation, ladies and gentlemen, especially out of these 11. The Netherlands, New Zealand, Switzerland, France, Germany, Norway. I mean, the UK. Wow. This is stunning, and it's also not surprising.